Vitamin D is a fat-soluble vitamin that plays a crucial role in the body's absorption of calcium and phosphorus, which are essential for the maintenance of strong bones and teeth. It is also important for the functioning of the immune system, and may have other health benefits as well. Vitamin D can be obtained from a few foods, such as fatty fish, egg yolks, and fortified foods, but the body can also make it when the skin is exposed to sunlight. The UV rays from the sun trigger vitamin D synthesis in the skin. However, it can be difficult to get enough vitamin D from food alone, and many people, particularly those who live in northern latitudes or who have darker skin, may not get enough sun exposure to produce sufficient amounts of vitamin D. A deficiency in vitamin D can lead to a number of health problems, including rickets, a disease that causes weak bones, in children, and osteomalacia, a condition that causes weak bones and muscle weakness, in adults. Vitamin D deficiency is common, particularly in older adults, people with darker skin, and those who are overweight or have had bariatric surgery. Symptoms of deficiency can include muscle weakness, bone pain, and an increased risk of falls and fractures. Vitamin D deficiency can be treated by taking a vitamin D supplement and/or increasing sun exposure. However, it is important to be cautious about sun exposure, as too much sun can increase the risk of skin cancer. It is always recommended to consult a doctor before starting any vitamin supplements. Vitamin D can be obtained from several sources. Some foods are naturally high in vitamin D, such as fatty fish, such as salmon, mackerel, and tuna, egg yolks, and mushrooms. Some foods, such as milk, cereal, and orange juice, are also fortified with vitamin D. The body can produce vitamin D when the skin is exposed to sunlight. However, the amount of vitamin D produced by the body varies depending on factors such as the time of day, latitude, and the amount of skin exposed. Vitamin D supplements are available in various forms, including tablets, capsules, and liquids. They can be taken daily or weekly. It is always recommended to consult a doctor before starting any vitamin supplements, as excessive intake of vitamin D can lead to toxicity, which can cause symptoms such as nausea, vomiting, and constipation, and in severe cases, it can lead to kidney damage. Vitamin D deficiency can cause a range of symptoms, which may include bone pain and weakness. A lack of vitamin D can lead to weak bones and muscle weakness, which can cause pain and an increased risk of falls and fractures. Fatigue and general muscle weakness. Vitamin D deficiency can cause fatigue and muscle weakness, making it difficult to do everyday activities. Bone deformities. In children, a lack of vitamin D can cause rickets, a condition that leads to softening and weakening of the bones, which can cause deformities. Depression. Vitamin D deficiency is linked with depression, which can cause feelings of sadness, hopelessness, and a loss of interest in activities. Slow wound healing. Vitamin D is important for the immune system, and a deficiency can slow down the healing process of wounds. Impaired immunity. Vitamin D deficiency can also increase the risk of infections such as colds and flu. These symptoms may not be specific to vitamin D deficiency, so it's important to consult a doctor to confirm the diagnosis and rule out other possible causes. Vitamin D toxicity, also called hypervitaminosis D, is a condition that occurs when there is too much vitamin D in the body. It is rare, but can occur when someone takes very high doses of vitamin D supplements over a prolonged period of time, or if they have a medical condition that increases the amount of vitamin D in the body. Symptoms of vitamin D toxicity may include 1. Nausea and vomiting. 2. Loss of appetite. 3. Constipation. 4. Weakness and fatigue. 5. Excessive thirst and frequent urination. 6. Confusion and disorientation. 7. Itching and a metallic taste in the mouth. 8. High blood pressure. 9. Kidney damage. If you suspect you have symptoms of vitamin D toxicity, it is important to see a doctor immediately. The treatment for vitamin D toxicity involves stopping the intake of vitamin D supplements, and in severe cases, hospitalization might be required. High blood calcium levels due to vitamin D toxicity can be treated by medications and fluid replacement to prevent kidney damage. Thanks for watching, and don't forget to like and subscribe for more informative videos like this one.